Hello and welcome. My name is Alma Siliesar. I serve as Director of Constituency Services and Membership at NALEO Educational Fund. Welcome on behalf of our CEO, Arturo Vargas, and our Board of Directors. We would like to thank our presenters for joining us today. Thank you for taking the time out of your busy day to participate on this webinar and for sharing your expertise with our NALEO membership. Today's webinar, Essential Components of Local Response to COVID-19, is the first one of a series of webinars that are part of the NALEO Virtual Policy Institute on Emergency Response and Management, Strong Local Leadership in the Face of COVID-19. This Policy Institute will provide Latino policymakers with the opportunity to enhance their knowledge of key elements of emergency response and management, specifically on COVID-19 efforts and the role they play during these critical times to ensure their jurisdictions are responding to this crisis in the most effective way possible. This webinar is being made possible with the generous support of our Institute title sponsors, State Farm, investor sponsor Walmart, and supporter sponsor American Fuel petrochemical manufacturers. We value their longtime partnerships and support to make this timely policy institute and webinars and other professional development opportunities possible for our membership. We have a great set of speakers joining us today. Between our three experts, we have a lot of expertise in the fields of public health preparedness, emergency preparedness, and response and management. This webinar is being recorded and will be made available to all of our members on demand for future reference. Now it is my pleasure to introduce our presenters. They, as I mentioned, have very impressive backgrounds and bios. I will just share brief highlights. We will first hear from Dr. Oscar Allen. Dr. Allen serves as Program Officer at the National Association of County and City Health Officials, also known as NACHO, which represents the country's 3,000 local governmental public health department. He oversees NACHO's programmatic divisions on infectious disease, informatics, public health preparedness, readiness, resilience, pandemic, and catastrophic preparedness. Dr. Allen has an extensive background on public health. Our second presenter is Mr. Francisco Sanchez, Deputy Emergency Management Coordinator for the Office of Homeland Security and Emergency Management for Harris County, Texas. The office is responsible for disaster preparedness and response in the nation's third largest county. Mr. Sanchez has served on command staff for 4 of the nation's 10 most devastating natural disasters and is involved in public safety at the local, state, and national levels. He is also currently serving as the president of the Emergency Management Association of Texas. Lastly, we will be joined by the Honorable Clay Jenkins, County Judge for Dallas County in Texas. As a county judge, he serves as the head of emergency management in the 2nd most populous county in Texas and the 9th most populous in the United States. Judge Jenkins has managed a number of emergencies during his tenure, including the Ebola pandemic in 2014. We are extremely grateful to have all of them joining us today, and I will now turn it over to Dr. Allen.
Thank you very much, Alma. It definitely is a pleasure to be with you all today, providing an update from the coronavirus from the National Association of County and City Health Officials perspective. As was mentioned, we represent the 3,000 county and city health departments who are roughly those 150,000 staff members that are on the ground in the front lines with respect to coronavirus. And it is very important that we understand the role that all aspects of our health infrastructure, including our public health workforce, is playing in this essential issue. When you look at the global summary, we've made several key points where we've amassed over 1.2 million folks that have been confirmed with this illness, and of course, crested over 67,000 deaths thus far. And obviously, those numbers keep rising. When you think specifically, however, from the summary in the US, as you can see in the past few weeks, the United States has become the epicenter of this pandemic. Roughly over 370,000 cases in all states, territories, and Washington, D.C., over 11,000 deaths, many of which have been, of course, travel related. Right now, significantly case-to-case, person-to-person spread, and several other health workers included who have been exposed to this particular illness. When I illustrate this particular map, it tries to illustrate from a county perspective the number of individuals, the number of cases that we've actually seen confirmed across our nation as it pertains to coronavirus. And similarly, this next graph looks at the COVID mortality, meaning the number of individuals who we've seen died as a result of this illness. And this goes to show that we have it in all walks of life and all aspects of our country, and why we must have some continued concern about what we can do to stop its spread or slow it down as much as possible. And speaking of it, and maybe be repetitive for some folks, but I'll just go over some key points. When we think about the illness severity, we've seen, of course, the telltale signs of fever, cough, shortness of breath. But we recognize that there are a lot of reported illnesses, some that are very mild, and of course, those that are more significantly severe and resulted in possibly death. So from the lens of where public health sits and the desire to not only focus on what are the key risk factors, whether you are an individual with ongoing, in a community that has ongoing spread, we consider that to be elevated risk. If you're a healthcare worker, of course, those that are on the front lines, doctors, nurses, nurses' aides, home care, long-term care facilities, public health professionals, you are also what we consider to be at an elevated risk of exposure. Close contacts of individuals, and of course, those who used to travel in some respects before the travel restrictions came into play, were also areas that we identified as being of elevated risk. So the entire national perspective is in the whole nation approach has been a portion of at least trying to stop the spread or slow the spread of the illness as it passes through our communities, our homes, and our nation. And a lot of the telltale issues have been how to reduce the likelihood of spread, the avoidance of social gatherings, the full implementation of social distancing, practicing good hygiene, and of course, reducing the likelihood of spread of illness to others who are most vulnerable in our population. Some of the actions that have been taken into place at this present moment. We've seen an increased amount of community-based testing sites that have been established in many cities across the country. There's been a lot of focus on screening and quarantine, and additionally, work on vaccine and treatment development, in addition to identifying several guidance, focusing on our pandemic preparedness plans, which I know my colleagues will speak to in a few moments, as well as focusing on an interagency situational awareness as to how can we work collaboratively across these several states to ensure that those supplies that are in critical need and the workforce that's going to be necessary to sustain this response and this fight against coronavirus for the next few months to come. With respect to laboratory testing, we've now seen that over 95 public health labs are now running the CDC assay, meaning the test that was developed to detect coronavirus. In addition, or I should say, as a large cumulative number, there have been 1.7 million samples that have been tested by state, local and the commercial and hospital labs, and including the CDC and the Veteran Affairs at this point in time as of April 6th. Now, that means there's been a lot of focus on trying to get individuals tested in a much rapid fashion than we saw earlier on at the start of this outbreak. And you probably know this particular slide like the back of your hands now, which make me proud as an epidemiologist. But this really speaks to the impact of community mitigation, how we can try to slow the spread, flatten that curve, as you've heard said time and time again, to really ensure that we are being successful in not only fighting this particular illness, but trying our best to reduce the likelihood of it wreaking much more havoc in our midst than we would like. I provide an update with respect to the hospital utilization projections that you've probably heard over the course of time. And this current data just looks at it from the perspective of the entire US as to the number of hospital beds, the number of ICU beds, and the number of ventilators that are needed. And recognizing that these are projections, these are ideas based on what we currently know, and looking at the impact of the social distancing, the anticipation is that you probably would have about 140,000 beds that are needed, a reduction from in the past, but totally seeing around 29,000 ICU beds and 24,000 ventilators when we think about the peak resource needs going upwards until April 15th of this year. Now, the death projections, and you can see the variation between the dotted line and the shaded area. It can go up or down, but the idea is if we are able to be successful in reducing the impact of the spread of this disease through our population, we can project up now going towards August of roughly about 81,000 deaths. And as I recognize, these numbers are models. They can change based on new information and new data as we progress through this particular pandemic. There have been tons of guidance and resources that have been made available. And hopefully you and your constituents will also be able to avail themselves of this degree of information. The CDC has a very robust and comprehensive website. There have been updates with respect to alternate care sites. There's been clinical guidance on how people who are confirmed with COVID, what you can do around your home, how you can also help your neighbors, or I should say your family members, what you should do to ensure if you're feeling sick that you can test yourself. There's a COVID self-checker. There's strategies for addressing the personnel shortages that we're seeing. There are fact sheets for the transit workers and other individuals that are essential members of our workforce, pharmacy guidance, and you name it. There's some bit of information and guidance for everyone, and we hope that you will be able to utilize those resources and guidance to your benefit as well. When we think about the policy implications and, of course, representing the public health departments, I will say that a lot of questions have been brought up. Well, what has public health been doing, and what about all those dollars that have been spent over the course of time for preparedness and response? And the two streams of funding have been on these particular areas: hospital preparedness and public health emergency preparedness funds. And what I'm illustrating here in this graph is to illustrate that there's been a 36 or close to 40% cut in funds from 2005 up until 2020 with respect to public health preparedness and hospital preparedness. What that means, the dollars that have been associated for sustaining public health and hospital preparedness over the last number of years has focused on developing plans, testing those plans, and trying to ensure that there is at least a system in place to respond. What it does not speak to, of course, is the sustained effort that would take in trying to address and continue to keep a response as what we've seen and what we anticipate with COVID-19. And as a result, there's been emergency funding for coronavirus developed both by the Congress and passed thus far, where we've seen advocacy by public health partners as well as organizations like ourselves, a fight to ensure that there is $950 million that would be allocated to states and localities so that they can conduct surveillance, epidemiology, lab capacity, community mitigation, communications, and all of the aspects of the response activities. This bill also provided reimbursement of costs that occurred in January before many of the declarations, and also that there would be at least 560 million that would be pushed out to state health departments with a requirement that at least half of those dollars be provided to locals within a 30-day time frame. So local communities, especially those that you represent, are going to be dependent on these state health departments to provide enough funding to the local level to address the pandemic. Additionally, we've seen 826 million for the National Institute of Infectious Diseases to develop vaccines, cures, and tests, as well as 300 million to help buy those treatments once they have been approved. Additional emergency funding, we've seen $45 billion going to FEMA for state, local, tribal, and territorial governments, 1.5 to CDC, 500 million for data modernization. How best can we access data and use it in a way to support the response effort, as well as 90 million for Y and White and 250 million for hospital preparedness program. Now, I say all of that because, especially looking at the constituents and the workforce that you represent, we've seen a reduction in the staff and workforce at state and local health departments since 2008. We've lost about 50,000 jobs across the country. And we also recognize that half of those are also, half the remaining public health professionals are eligible for retirement. So what that speaks to is that we recognize that there's an opportunity here, not only for us to focus on building that workforce, but trying to ensure that we're sustaining those individuals who are vital for us addressing these types of pandemics and other outbreaks at the front line whenever we need them the most. Whether it's looking at opportunities around loan repayment programs, but we've also seen a desire to continue the fight in the national level to ensure that there's adequate dollars being put forth, not only for support of the public health workforce, but additional funding to really protect the public health and ensure that state, local, and tribal and territorial health departments are at least at the forefront of your thoughts when trying to defend our essential fight against this particular disease. So with that, I thank you for the opportunity to speak and definitely am excited that we are a partner in all efforts to address the COVID response and how we can hopefully return to a period of time that we can probably designate as being normal again. Thank you very much.
Thank you so much, Dr. Allen, for such timely and important information and insights that you shared with us. We will present some questions at the end, but I will now turn it over to Mr. Francisco Sanchez.
Great, thank you, Alma, and the team and doctor. I'm going to, there we go, load my slide, and you should be able to see that. Thank you so much. First, for a little understanding and context, explain to you sort of what Harris County is and where we are for a little bit of context. Harris County is 1,777 square miles. We are the third largest county in the United States by population. And so we also have the Texas Medical Center here. And to add a little bit of complexity to that for Harris County, for many of those of you that are in multi-jurisdictional environments, you'll understand what this means when we've got 34 cities, 56 fire departments, and more than 125 law enforcement agencies. It's a multi-jurisdictional environment where there's a lot of collaboration that's needed. The most critical thing that is not listed here is the fact that Harris County has two public health authorities within its borders. Harris County, which is not only in charge for the unincorporated part of Harris County, but also 33 other cities, and those are cities that do not have a public health authority. The second health authority inside Harris County is the one that is inside the city of Houston. And so what that means is we have to have a great team effort in how we execute our strategies, because it does not matter. It doesn't, you know, if those two aren't in tandem and working together, we're going to have some problems in having a uniform strategy across the board. And so that's important. And we're also in a 13 county region. that are contiguous to one another. So that's another thing we have to consider. Again, disease outbreaks, hurricanes, tornadoes, floods, those kinds of things don't recognize jurisdictional borders. And so this unified effort in terms of how we approach our response to the novel coronavirus is even more essential. But in that regard, it's not any different than how we do responses to disasters. A little bit of where we are in terms of the response itself. Right now, Harris County is at level 1. That means that we are at the highest elevated level possible in terms of how we respond to any type of disaster. We have 4 different levels. We started out at level 3 on March 2nd. And for a little bit of context, what that means is today, in fact, we marked 37 days in this activation, which matches our previous longest activation ever. When you look at those activation day slides, that actually should be a little inversed. ITC, which was an industrial explosion last year, we were activated for 37 days, and that was our record. We were 26 for Harvey. So at midnight tonight, we will be going into day 38. And we expect to be doing this for several more weeks. And so this by far will be the longest activation that many of us have been at this level for in the county. And I imagine that many of the jurisdictions across the country are going to be in the same boat. So one of the critical things that you need to understand is make sure that your team is prepared for the long haul, to take care of themselves, to recognize how long we'll be going at this, to make sure that the rotation of teams takes that into account, and that you as elected officials, and especially if you're a county judge or a mayor or a governor that is in charge of emergency management and this response, that you take care of your own personal health, both physical and behavioral and mental, to make sure that you have the ability to respond to this disaster in as best way as you possibly can. Where we are, we have currently about 1,800 and some positive cases between the city of Houston and Harris County. We've got about 250 so recoveries and 22 deaths as of now. The number gets even larger when you look at the counties outside of Harris County, but these are the numbers right now. We have created a dashboard at readyharris.org. Our emergency management page has basically been provisioned, so it's all about the coronavirus response, not only in what resources are available, news updates, the latest information is going on there as well. We have also added a feature where you can text CV19 to 888-777, so we've got a specific short code that has worked very well for us in terms of communicating to the public. So this way people can get the responses that we're pushing out by text. And so those numbers will continue to change. For a little bit of perspective, we are early on in this process. And so we expect the numbers to continue to climb in Harris County, largely because testing capability is beginning to surge in. And you'll find that across the board. The more you test, the more cases you will find. And that is simply, we'll sort of just touch a little bit on how deep it is in the community, and we'll have to rely on modeling, but that's kind of where we are now. And we have not yet, according to our experts, hit the apex. So we'll be going at this for a little while before we reach where we expect that apex to be. And at that point, we'll have to sort of ride that wave, try to manage those expectations and those resources before we start seeing those numbers come down. So for the Harris County side, we're a little bit behind in terms of when this started to get more serious as compared to other cities. The benefit for us has been that we've been able to learn from those other cities that have been facing this a little bit earlier and trying to apply some of those lessons learned. I think that's absolutely essential and critical. So if you are in a community that is barely starting to see increases and is only now being impacted by that, I strongly urge you to look across the country and across the globe and try to capture those lessons learned as your response initiates, to be able to run with those and take the benefit of having to learn those from somebody else, as opposed to learning those lessons the hard way. Initially, we started with a regulation limiting bars and restaurants was our first approach. One of the first questions, if you're going to face, if you haven't faced it already, is how will you deal with mass gatherings? Because social distancing is really the backbone of how we limit the spread of this disease. And we started with restaurants and so that they are only delivery, takeout, and drive-through, no dine-in service. And so obviously that is something that has economic consequences, but it is something that still needs to be done. And the reason also that we are making sure that restaurants continue to be open is they have their own different supply chain when they get the food they need for service. And that's different than the grocery supply chain. And so those are two different supply chains that we want to make sure that remain open and as unhindered as possible, because they're absolutely essential. So it also, by keeping the restaurants open, it diminishes or it helps reduce the increased impact that you will eventually see on grocery supply services in that supply chain. The supply chain is there, but you will see communities react and want to stock up on items. And so that's another reason why that's critically important. And we also established a hotline where if there was a violation and that people could call in and report that. The way we approach that is the first time someone has to go and knock on that door and say that you shouldn't be open or to get more information. It is just sort of a soft touch in terms of, hey, here are the rules, here's what you should be doing to be in compliance. And then our hope and expectation is that they comply. If that does not work, then we move towards more enhanced compliance and enforcement. And so that could come with either a fine and if necessary, a jail sentence. And so that tends to be a pretty harsh deterrent, at least on that level. From there, we moved to something called stay home, work safe. We avoided the terms lockdown or shelter in place for a couple of reasons. One, depending where we were at that particular stage, was that it was not quite the message we were trying to get out, but we did want to make sure that we had the restrictions in place. And so anything that is not essential right now in Harris County is shut down. So how we defined essential is it critical infrastructure, and we used some DHS guidance out of something called CISA, where it identifies what critical infrastructure resources and industries are. For example, transportation, healthcare, the grocery supply chain, transportation, telecom, those kinds of things that we need to make sure that society is functioning remain open. And work safe is sort of how we make sure that those businesses and government organizations that need to continue to operate work in a very safe way. Social distancing of at least 6 feet, making sure that the only people that come in, even if you are an essential business or an essential function, are the employees that are absolutely essential to make sure that you can fulfill your mission. We've had a lot of support from the business community. If you visit houston.org, we also have that on our Ready Harris page, is some guidance that was put together by essentially what is our chamber and business group here in Houston in terms of what you should be doing as an employer to keep your employees safe. And so they were very, very proactive. And so that provides some very real answers that are going to be needed by business folks in your community if and when you have to do that. And so a lot of that homework has been done. Again, we want people to capture lessons learned. And so feel free to borrow from any of those resources. When it comes to orders, those are also available on our website, and that might provide some guidance for you. But any of those should definitely be run by your city or county attorneys and should try to coincide, with whatever maybe at the state level. Again, recognizing that local government are those folks that are closest to the disaster. Additional orders that we have been working on, one is the release of inmates from the Harris County Jail. And those were very specific. If you were going to be released from the county jail, you needed to be a nonviolent offender, and there were also other criteria that you had to meet. And so that was a local initiative. Again, a little bit something to understand is then the Texas Attorney General came in and halted that order. Just just for some understanding, you have to understand that there are things that go from city to county to state, and that sometimes there may be challenges in implementing some of those orders. We also recently had the cancellation of a tax auction sale here in Texas on a certain Tuesday, I think the first Tuesday of the month. If your property has been foreclosed on, it is auctioned off at a public auction. And so we canceled that for a couple of reasons. One, it was a mass gathering. Secondly, we also had an order that prohibits evictions. And so our concern was that you would then put people on the streets and make them more susceptible to the coronavirus. Public health and OEM are absolutely essential partners. There are a couple of instances when the Office of Emergency Management is actually not in charge of a disaster. One of those is a public health incident. That is where the public health authority is actually in charge. And so that is something that we are practicing in real world. It's something that is often tested through annual exercises, but this is the first time many communities across this country are actually experiencing that dynamic. And so for those folks that are used to the emergency management model, we're learning some lessons as we roll this out. But again, it is a partnership between those organizations, with public health being the lead for some of those critical decisions, along with the elected official, and the Office of Emergency Management coming in, supporting with resources, information, and taking a strategic approach to ensure that our response is successful. These are some of the core partners that you will encounter. Some that you might not think about. We're counting on our engineering department to help us build out surge hospitals. The county attorney obviously is critical. Universal Services is basically our information technology department. As we have sent a significant number of our personnel to work from home, you will need, they're providing, make sure we have internet capability, making sure they have laptops, and those kinds of things are essential, because as our folks go home and start relying on the internet and telecom, those systems are already exacerbated by people being at home and increased demand. So they're helping us work. Obviously working with our faith-based community, with our schools and nonprofits to make sure that we're all moving this forward as a community and being on the same page. Looking for the next 4 to 6 weeks, one of the things we're going to be monitoring is hospitals and what does that surge look like. Social services, as we start seeing businesses shut down and people going out of work, what can we do to support them with food and other resources? Mental health will be a critical issue. And as government looks at reducing itself to even more essential functions, what is legally required for us to do? And in this time and space, what are the functions the public expects of us to be able to successfully respond to COVID-19? And how do we put people in the right places to serve and fulfill those functions, even though it might be outside their traditional role? Communications, making sure we address the whole community. And trust is going to be a critical factor. This is a unique disaster, and so we have to recognize that sometimes we have to look for partners outside of government to deliver that message. And our typical approach is our 3C plan. Communication, cooperation, and coordination are absolutely essential to how we respond to disasters, and I would say even more so because this is a unique disaster. So questions moving forward, what's next? Try to plan for the worst case scenario. Look at the forecasting, which is something that is changes on a regular basis. Know that you will have challenges getting supplies. So when your initial plans fail, what is the next phase? And know that there's a great challenge that you have to overcome. But don't be afraid to be the person that's asking those critical questions. What's next? What happens when the plan fails? And what's coming down the pike? This way you will have the time to sort of process those. And one of the most critical points is no matter what we do as government, the most important factor in determining how successful our response is going to be in this fight against COVID-19 is what individuals do and what the community does. So social distancing is important, and making sure the community is a part of that and understands that is absolutely essential. There is a blog out there, and if you text NALEO to 888-777, this is about a 5-minute read that will be a good resource for you in terms of what you should be keeping in mind, either as an emergency manager or an elected official as we move forward. And so that's my presentation. Looking forward to answering your questions at the end of this.
Thank you so much, Francisco, for sharing the efforts in Harris County to responding to this pandemic. We greatly appreciate you sharing some of those partnerships and efforts that the county is undertaking right now to ensure that the community continues to stay safe. Just a couple of questions before we continue with our last presenter. And this is, I think, for Dr. Allen. Doctor, can you further discuss on efforts that are already being thought about to rebuild the public health professionals workforce?
Yes, thank you for that question. So one of the things that we've been focused on, at least from the lens of the funding, recognizing that the Congress has permitted or provided at least $950 million for public health. And then there was a second and I think a third package that's being delivered or being addressed around infrastructure. Our goal, at least what we would like to see and recommend, is when we're discussing what those infrastructure needs are, that we are also not just looking at physical property, but also the people. So investments in ensuring that there's an opportunity for local communities to have the right amount of professionals in their workforce, whether it be public health nurses, whether it be health educators or community health workers, or epidemiologists, or any environmental inspectors, or environmental health folks. All of the folks that I think our colleagues just mentioned just now are indication as to where we can really, as elected officials, try to focus some of the efforts in not only recruitment, but ensuring that we have a pathway forward for training, as well as for getting on-the-ground applied public health experience. So those are some of the categories. I would say that there are other examples of how people are able to get into the workforce, but I think now it's illustrative of the best time effort possible that we can really focus on improving the benches, I would say, of how we can get folks to really support our vital healthcare workers as we see them now.
Thank you, Dr. Allen. Thank you for sharing that. We are being joined by Judge Jenkins, Dallas County Judge. He will now join us and share with us how the county's experience responding to the Ebola pandemic in 2014 prepared Dallas County for the COVID-19 response. Judge Jenkins, welcome. Thank you so much for taking a few minutes of your busy day to join us and share from your experience with our members.
Oh, my pleasure. Great to be with you. All of these things have a few things in common. So whether it was Ebola or this or other things like West Nile virus or floods or police shootings, etc. Leadership works best when you stay calm and allow those around you to be calm. People rarely make good decisions when they're angry or upset or afraid. And so I think that's a key tenet. And then treating other people the way you want to be treated. That's a key tenet. And following your instant command structure and delegating a lot of authority to a lot of good people, including, by the way, the leader of our Dallas County Unified Supply Chain for PPEs, hand sanitizer, and other important life-saving things is a NALEO member, Miguel Solis. There may be other NALEO members on the team as well, but I know he is one. This particular outbreak has been a tough one for us. We were the first in the state to close our bars and restaurants. And then we were the first in the state to move to a safer at home structure. And when others didn't follow, I had to push on them in direct and hard ways to get them to follow. and that left people with some hurt feelings and ruffled feathers. And so, you know, we're having to deal with a lot of political sniping from the other executive elected officials in county government and even from our own governor on this. But, you know, I think we're all mostly moving in the same direction now. And I think what we're seeing is that with our Safer at Home, for those of you who haven't enacted that as early as we did, we're seeing a lot of really positive results from that. And that's not just what I say, it's what the DFW Hospital Council say, and it's what the predominantly Republican business community, I'm a Democrat, it's what the predominantly Republican business community says. So if you're catching any grief at home, and I'm sure you all are because we're catching some here too, on the issue of Safer at Home, or what's called shelter-in-place orders, then I just encourage you to stay the course, follow the science, and let's flatten the curve. It sounds like I'm going to need to go shut the door. Here comes a bunch of kids. I'll be right back. Any questions or anything else needed from me?
Thank you, Judge Jenkins, for again for taking a few minutes to join us and share with our members what the county's efforts are in response to this pandemic. Just one question: as Latino leaders that are working with their community, what can be done to ensure that people stay home from church during this Holy Week? Given that the state's not closing religious activities?
Well, we don't have as much of a problem with that here because Dallas County has the unfortunate distinction of last week we had the most cases, and now I think Harris County is slightly ahead of us. But even the governor agrees that in places that are as spreading as rapidly as Dallas, religious services in person would not be advisable. What I would suggest that you do is pull together your faith community. So very early on, I pulled the bishop of the Catholic diocese, the bishops of all and heads of all religions that have a hierarchical body, a conference or something, as well as the mega church pastors and some of the influential people in the smaller church pastoral groups, as well as synagogues and mosques. And we're working together on this so that those pastors, when the governor passed his order saying everybody go back to church, the pastors immediately started writing, and priests and rabbis and whatnot, imams, immediately started writing saying, no, don't do this. This is bad. We don't want this. We need to, you know, flatten the curve, save lives. We were able to lobby, if you want to call it that, the governor, and over a 24-hour period, he sent out a clarification saying that they'd remain closed here. We do allow, by the way, so I'd really recommend working with your faith community on this. They're a tremendous, partner. And then the other thing is we allow drive-ins here. So we allow, we have the churches and synagogues all set up a situation where free of charge, they will produce for the small churches that don't know how or don't have the capability to do it, there are programs for them and help them get those to their members through the internet. And so, hopefully that helps. And I know there's been a lot of faith leaders that have been happy in small churches about that. We also allow drive-ins for Easter where the cars are 6 feet apart and they can kind of go to church like a drive-in movie. But we don't allow any in-person, even 5 or 6 people sitting in a room for worship services. The only things we allow are, essential trips out of your home for essential business or to exercise. Beyond that, people that don't work in an essential business are asked to stay home.
Thank you. And this question is for you or Francisco. what resources or information, or how are you disseminating information to the Latino immigrant undocumented community that perhaps is not aware of the resources, or if they can get tested, or fear of it interfering with their status?
Well, if that's, you mean it's Francisco de la Torre? Is that who the Francisco is?
Oh, we are joined by Francisco Sanchez from Harris County.
Oh, well, I'll give you the Dallas County perspective. Rebecca Cuna, who's on our staff here, who, like Miguel, came back from the private sector. That's one of her core jobs, and so she works to help get that out. We got an interpreter that interprets everything I put out, and we work closely with Telemundo and Univision in particular, and also Al Dia. These are Al Dia is a newspaper here, to get that information out. And I thought you were asking. I thought when you said Francisco, you were asking about General Consul for the Mexican consul, Francisco de la Torre, who's also, you know, kind of an ex officio member of the team and helps us get out the information. But I'll turn it over to Francisco in Harris County.
Sure. One of the things we've been working with here is also the immigrant community to make sure, use them as a voice multiplier to make sure that our messages get out to them. One of the creative things that we have done, if we have a news conference, for example, is we've got a live interpreter in the next room so that any media, whether English or Spanish language, can tap into that automatic feed from our emergency operations center. And in real time, that is translated to in Spanish. We've been capturing a lot of the information from our public health partners and putting that in Spanish based on, you know, if you've got a tax office, for example, that's closed, or an elections office, they are legally required to produce in multiple languages. And so since there's not a lot of that happening right now, we're borrowing that talent to do that as well. And this way we allow them to work remotely to do that. And we're also making sure that we do outreach to that community. And then provide that also to our faith-based community so they can go in and push those messages out in different languages as well.
Great, thank you. And for those local elected officials that might be wondering or doesn't know how they can get one of those mobile testing sites into their community, how would one go about that? What are some of the procedures to get one of those mobile testing sites into a community?
So, you want me to answer that, or?
Sure, Judge, go ahead.
Sure. So as far as we have two, and I just reached a deal within the last hour to keep them open with HHS, who had said they were going to cut funding on Friday, but now we'll keep it open for another, at least to the end of the month. We got those when they first opened up. We were adamant that we wanted them. We haven't had the ability to expand them, so I don't know exactly how you would go about getting one now. I'd say if you don't have one, though, the best way to go about it would do put in a star request, have your mayor or county judge put in a star request. Well, I guess this is a national audience, or is it just Texas? National? Okay.
It's national.
So, okay. So have your mayor or county judge put in whatever the request is called. It's called a star request in Texas. It's a request for federal help through the whatever it is, and it's called the Texas Division of Emergency Management in Texas. Whatever that is, the local state FEMA in your state, that'll go up to the governor. Also, you want to reach out to your region leads at both FEMA and HHS. So for instance, Texas, New Mexico, Oklahoma, several other states are in Region 6. The FEMA lead is Tony Robinson. The HHS lead is Mr. Schuster. And I'd reach out to both of them and tell them why it's very important with the emergence of the disease, et cetera, that you get one in Albuquerque or you get one in, El Paso or wherever you don't have one.
If I can add to that, that's the Federal agencies are also working on the development of private testing facilities through some of the major players such as Walmart, Walgreens, and CVS. So look out for that information. It will be coming out. So apparently a number of these sites will also be available in communities in addition to the community-based sites that the judge just mentioned.
They sort of, for the planners that are going to be executing that, just a couple of lessons learned from the local level, and I think they've seen this in Dallas County as well, is when those testing sites come in, it's going to be a limited quantity, just a matter of how many tests are available and also how many people you can do if you're doing one of those mobile testing sites. Right now, our limit has been at 250 people per site. Part of it has been a staffing issue, and part of that has been how many tests are available. And so some things to consider once you actually conduct those tests. It will be a few days to several days before people get those. As those start to wind down, like we're going to see in maybe Dallas and the Houston-Harris County area, as some of those start to fade away and elsewhere, you will be able to continue those tests, and you'll have to work through your emergency management partners at the state and federal level. And then you can begin and sort of assume those testing sites with local resources. That will become at a cost share, but I think that's important through the disaster declaration to understand that. Hopefully for communities that have not seen the brunt of this, if you start finding yourself in that situation, hopefully at that time, some of the testing would have caught up, and some of those tests, more of those tests will be available. And as we move down the line, we hope some of those more expedited tests will also begin to surge into local communities that can be utilized for that.
Thank you to each and one of you. Very important information for our members to know as they're doing this efforts at the local level. I think we have time for two last questions. One, what public-private partnerships or collaborations have proven invaluable when addressing the COVID-19 response from your perspectives in your jurisdictions? Any best practices that you can share that perhaps can be replicated in other jurisdictions?
Francisco, you want to start? You want me to start?
Sure, I'm glad to start. So one, we have done, we've mentioned that collaboration is absolutely important. We've taken some stuff across the board, and we have done specific outreach to a few segments to make sure they have the information they need, because it's critical, important to us to have that partnership. One of those is the faith-based community, who's been very proactive locally in not only getting the message out with us, but also making sure that how they go into the holy season we're going into, do that responsibly. Schools, to make sure that as those are shut down, that they can continue to provide critical food services to those kids that need it. Our business community, and figuring out what they need for resources for their own recovery, but also relying on them to partner up and come with suggestions about how businesses that are essential can keep their workers safe, and setting that standard and doing that among their own community. And so that's been absolutely essential. I've got to brag on the great work of our grocery chain partners. You will see a rise in people wanting to go get groceries because they're simply concerned, and that's a very real concern. And they have been doing a phenomenal job in making sure that they have that supply there, trying to be with us to make sure people understand that that supply chain is fine. It just needs to be staggered in terms of how you approach it. And if you go to any grocery store here, and especially some of the big players like H-E-B, you will see that they've already got distance markers to get in to make sure you're doing social distancing. They've got those same markers inside. And so for critical services like that, those are some of the partners that we've had some great results with.
Well, yeah, and I would echo that. It's very important to look at all your essential businesses as partners. So starting with the essential businesses, I have weekly calls with the Texas Retailers Association. That's basically the grocery stores, big box stores, during this to converse about what the problems they're seeing and the problems that we're seeing. And so when it came to safety rules for workers, we let them write the first draft. Then we took that to the Food Workers Union, the Workers Defense Project, the Texas Organizing Project, the AFL-CIO, let them take a look at it. And we're able to come up with things that please both sides. And we've done that for each of our various essential businesses. Other partnerships, the faith community is an important partnership. Community groups are important for partnership. When we found that 70% of the people that were going to the North Texas Food Bank were new customers that had never experienced the kind of hunger that took them there before, we sent a star request up to the governor, and I just had a call with the chief of staff a few minutes ago about this, to requesting help with food. They were unable to help us at this time, and so we were able to, within 24 hours, although I think they're trying to take a look at it, and they did help us with some Army National Guard guys to help box the food. But as far as like providing food, we were able to set up within 24 hours with North Texas Food Bank a neighbor, something called the neighbor to neighbor virtual food bank, where people give money online to the food bank. And we've raised quite a bit of food money through that over the last 45 hours or so. And so all of those things, the advantage that you have right now is everybody wants to work with you, right? We have not seen anything like this in our country in our lifetimes. And really, there hadn't been a pandemic like that since 1918, so 102 years ago. So everybody wants to help, right? For whatever reason, because they want to get it over with and get back to work. But most people want to help because they're fearful of what is going to happen to their loved ones if we don't get this thing defeated. And so I would just tap into anyone you can think of to be your partner. I've got the regional chamber and the citizens council and every faith group and food banks and I don't know if he's a member or not, but I was texting about, as I said, I'm a Democrat, Ted Cruz is a Republican. We're texting all over this stuff all morning. So everybody wants to help you, and I'd take the help.
Thank you. One last question, and this is for all of you. Thus far, what are some lessons learned from your response to this health crisis that local elected officials or policymakers, healthcare providers should already be thinking about to better prepared for the next health crisis?
From the national perspective, if I may, gentlemen, from the national perspective, I would say, especially thinking about the elected officials, recognizing the position that they hold and how powerful that is in being able to not only advance some of the private-public partnerships that were just mentioned previously, but also recognizing the sustained effort that a comprehensive approach can work. So it's the combination of factors with your transportation, with your healthcare sectors, with your business sectors, recognizing not only their need to focus on preparedness plans, but how do we sustain this effort in a moment of prolonged crisis? And really admiring, I would say, that tenacity that folks have, I guess our American spirit for survivability, but also that we can push through any major obstacle that meets our way, even something as critical as this that has waylaid a lot of our normal day-to-day activities. But that, technically speaking, when we have a competent workforce, when we open the lines of communication, and when we bring each of our related assets to the table, we truly are able to see how we can be successful moving forward for this time to come.
And I'll echo that and say that when we think about this long term, what do we learn from this long term? What we've learned is what many people that are listening to this call already know, that individual health coverage is public health. And so in Dallas County, we have 500,000 people, some of them undocumented, but many residents who would be afforded Medicaid expansion, Medicaid coverage, if our state were not so dumb to have not taken the Medicaid expansion dollars. So I've got 500,000 people that work in these essential businesses, or were moving around for the months of February and March until the order was passed, who don't have health coverage. And folks, they're not gonna, we all know this, they're not going to the doctor with a runny nose. It's not their fault, but they're a vector for the disease. and the disease will spread rapidly through the neighborhoods that they live. It's the state's fault. And so I think if you live in one of those 13 states that hasn't joined the rest of the country in providing health coverage to the working poor, and the word, you know, and I say poor, you know, poor can have a negative connotation to workers who are making $16 an hour and less. And in some instances, $21 an hour and less because they're a single mom with a couple of kids. If you're not in that state, I would really suggest that you use this as a strong impetus to join the rest of the country and provide coverage for your people. Very worried about Texas because every other state that's 2 weeks ahead of us on experiencing this had the good sense to take that money. In Texas, we like to pride ourselves on how little we do for people who work for a living but don't make a lot of money. And now it's all coming home to roost as we try to deal with this virus because we're all so interconnected.
So I think the single most important lesson that we've learned, especially if this is really starting to creep up in your community, as we called folks across the country and across the globe, the single thing we heard the most is if we knew what we knew now, we would have put this in place weeks ago. And I think what you'll see, I think we saw it in Dallas County was pretty aggressive in doing this. Harris County was certainly aggressive in doing this and doing this a little earlier than the modeling across the country would have shown. And I think up to now, we had a study by the Kinder Institute that said because we initiated some of these protective measures early, we've saved a little less than 10,000 lives and less than just under 50,000 people going to the hospital. So I think in the end, those numbers will verify what we've done. And I'll just sort of close with this comment when it comes to lessons learned. The judge sort of mentioned this in terms of the last time you really did this was in the flu of 1918. We always like to capture lessons learned and learn from those in emergency management moving forward. The likelihood that we have the opportunity to look at these lessons later and enact them in a pandemic is not likely there. But we need to understand if we learn lessons now in the moment, that we need to execute them and execute them now because the chance to do that later, we just simply won't be there. And the other thing that I'll say when it comes to that is a big thing you can do in terms of local leaders, be adaptable, be flexible, be innovative, and do everything you possibly can. If you can issue a waiver for something, issue that waiver. If you can move a regulation to make this easier, move that regulation. And just do things, be nimble, be quick, and be as innovative as you can be and move those obstacles out of the way to do what you need to do because we need to do those today and we can't wait for those lessons learned later.
Thank you. And I want to be respectful and mindful of your time. Again, thank you so much for joining us. We greatly appreciate it. I know that the information that was shared here today was extremely helpful to our local elected officials that are supporting their communities' mitigation and response plan to flatten the line. So again, thank you. I would also like to remind our members that this is just the first of a series of online webinars, specifically on COVID-19 and the role that local leaders play in the response and management. I would also like to once again thank our Institute sponsors for whom without their support this convening would not be possible. Our title sponsor State Farm, investor sponsored Walmart, supporter sponsored American Fuel and Petrochemical manufacturers for partnering with the NALEO Educational Fund and investing in professional development opportunities such as this webinar for our members. And thank you again to each and every one of you who are the front lines of this health crisis, your leadership and time. It's appreciated. We wish you and your families that you continue to stay in good spirits and stay healthy. And thank you again for everything. And for our members, we hope you can join us on our second webinar of this series, which is scheduled for Thursday, April 19th. It is going to be on COVID-19, mass disruptor of education system and student learning. Thank you again and see you soon.
Thank you.
Thank you.